I'm Dr. Netta Mayer, your dermatologist at your doorstep and creator of DermBox. Today, I wanted to talk to you guys about acne, how we get it and what we can do about it. So when we talk about acne, we always want to talk about the 3 layers of skin. We have the top layer of skin called the epidermis, and that keeps outside out and inside in. Then we have the middle layer of skin called the dermis, where all the action is. Your collagen, your oil glands, your hair follicles, nerve endings, blood vessels, everything. And the last layer of skin is the fat. So when we talk about acne, we have to talk about the oil glands, which through a channel deliver oil to the top layers of our skin just to keep us moisturized. But the problem is with patients with acne, these oil glands blow up and become super enlarged. Why? Because hormones, stress, cortisol, diet, like dairy and sugar, and genetics all send a signal to this oil gland to get bigger. And when the oil gland gets bigger, the channel that delivers the oil gets bigger, which is why people with acne literally look like they've got open pores on their skin. It's an open pore leading to an enlarged oil gland. So the problem with that is natural bacteria on the skin that could never fall in this pothole now fall in this pothole. So now in this enlarged pore, you've got bacteria plus excess oil plus no exit, because all this oil traps the top layer of skin cells and makes them sticky. So there's the pressure until one time it just ruptures and forms an acne scar. So what can we do? The first thing we do is we go back down to the science. The main reason was the oil gland got enlarged. So how do we shrink the oil glands back down to normal size? With the cream version of Accutane called retinol. It always works. Why? Because it gets to the root of the issue. But instead of shrinking your oil glands in your eyes, your brain, your liver, your kidney, your pancreas, everywhere, which is what the oral Accutane does, it only shrinks them topically with the cream version called tretinoin. The second issue is to prevent the purge that happens. People say, I started a retinol and then I purged and I got acne everywhere. In order to prevent that, we also address the other 2 reasons, which are the bacteria got in and the pores got clogged. How do we do that? We say, okay, for the bacteria, we just want to sterilize the skin until the oil gland becomes normal size. As we know, that takes about 6 to 8 months. So every morning, use a topical benzoyl peroxide, clindamycin, that basically sterilizes your skin until this becomes this. And the pores got clogged, so what do? We give you at-home peel pads to use every other night, and once a month, you do a nice little acne peel that basically breaks up these dead skin cells. We always want to do that first before we start people on topicals. Why? Because we want to take almost that dead cellophane-like layer off the top layer of skin before we apply our topical tretinoin and things like benzoyl peroxide, benzocaine. Now you can see you can't put whatever moisturizer, whatever sunscreen, whatever makeup you want, which are the only other things that should ever be on your skin. Why? Because it's gonna clog your oil glands the same way acne did. So we say everything water-based. Water-based moisturizer, water-based sunscreen, and water-based makeup. I hope that was helpful, and I can't wait to tell you how we treat acne if these things are struggling.